Thanks for joining us for this Modifier Monday, Modifiers 73 and 74 webinar. My name is Mary Mucko. I am a specialist on the Provider Outreach and Education team at WPS Health Solutions. I will be your host today. Assisting me is my friend and colleague, Aline Ziegler, also a member of the Provider Outreach and Education team. We include this disclaimer in all our education, and we do so to remind learners that although we made every effort to provide current information that is correct, the information is indeed subject to change. It is on the CMS website where you will find the Medicare rules that determine final coverage. These laws, regulations, and rulings will always prevail. We will provide responses to questions based on the facts given. And that last statement there is just a reminder that CMS prohibits recording of this presentation for profit-making purposes. We are recording this webinar and we will post it as an encore presentation to both our Encore Presentations webpage and our YouTube channel. You can stay informed about new postings of the latest Encore presentations and other education events by reading the education news that we post each week on Wednesday. To receive that notification, you would simply need to subscribe to our e-news. Here is the agenda for today's presentation. We will have about 45 minutes to spend together today. And we advertise that during today's webinar, we will give definitions for these modifiers, that is modifiers 73 and 74. I will provide examples, and I will discuss the effect on payment when these modifiers are reported on the claim. I'll share some appropriate and inappropriate uses and what to include in the operative report. Your presentation materials include many embedded links for some helpful resources to assist in the correct reporting of these modifiers. Here is the definition for modifier 73. When modifier 73 is appended to a surgery code, it means discontinued outpatient hospital or ambulatory surgical center procedure prior to administration of anesthesia. And that last part of the definition really is important, prior to the administration of anesthesia. This is an example of when to consider use of this modifier, modifier 73 that is. Here's the example. A patient with inguinal hernia presents for open initial inguinal hernia repair. The patient is taken to the operative room, prepped for surgery, and prior to anesthesia is found to have high blood pressure. The provider then decides to cancel the procedure. An elective cancellation of a procedure should not be reported with this modifier. So how does use of the modifier 73 affect Medicare's payment? Surgical or certain diagnostic procedures that are discontinued after the patient has been prepared for and taken to the operating room, for which modifier 73 is reported, will be paid at 50% of the full outpatient prospective payments system, or the OPS payment amount for the facility. This is not subject to the multiple procedure discount, so no multiple procedure discount applies. The key here to remember is that this is a surgery that is reported only prior to the administration of anesthesia. So due to some complications or something that the patient is undergoing, such as the high blood pressure, remember that it has to be prior to prior to the administration of anesthesia where this modifier would be reported. This slide shows when it is appropriate to use modifier 73. This says when the well-being of the patient is threatened, The physician may cancel a surgical or diagnostic procedure after the patient is prepped, and this would include the sedation, being taken to the operating room where the procedure is to be performed. But remember, this modifier is to be used only prior to the administration of anesthesia. It is not for those situations when the physician simply elects to discontinue or to not perform the procedure. Only hospital outpatient facilities and ASCs should use this modifier. We also include in this education today some inappropriate uses of modifier 73. There's a few listed here. There's also some listed on our modifier 73 fact sheet, and I'd like to show you where that fact sheet appears on the WPS website. So if you are looking at the WPS website, let's say you're on the home page, you're just logged onto the website, there's a couple of ways you can find our modifier fact sheets, not only just for 73 and 74, but for other modifiers as well. Today, during this presentation, we're talking only about modifiers 73 and 74. But if you're on the home page or any page of the WPS website, you can simply go to the topic center listed at the top of the page and then select Claims. When you select Claims, you will find many different guides and resources. And we're talking about modifiers and looking for information on modifiers, so we're going to select Modifier. And again, and you will see when selecting those links, all of this information appears. We have general modifier information. We have advanced beneficiary notice of non-coverage or ABN modifiers, ambulatory surgical modifiers, anesthesia modifiers, and so on and so forth. These are listed 73 and 74, or at least 74, under modifier 74 fact sheet, under the ambulatory surgical center modifiers. So when viewing the modifier fact sheet, this one is for 74. I have 73 ready to show you as well. You will find we include the definition, we include appropriate usage, inappropriate use, and sometimes some additional information that's helpful to the person billing the claim or submitting the claim, preparing the claim, and so on. So let's talk about those inappropriate uses for modifier 73. If the physician or provider cancels the surgical or diagnostic procedure, and this modifier is used for some diagnostic procedures, when the physician cancels these prior to the administration of anesthesia, but after the surgical preparation of the patient, it is appropriate to consider it pending a modifier 73. It is inappropriate also to report this modifier for the elective cancellation of a procedure when anesthesia was not planned for the procedure. Use of the modifier by a physician. Physician can't report 73. It is appropriate only for facilities or ASCs. It's also inappropriate when the surgeon cancels or postpones the scheduled surgery because of a patient complaint, such as a cold or a flu. Let's move on now to modifier 74. Here is the definition. Discontinued outpatient hospital or ambulatory surgical center procedure after the administration of anesthesia. So modifier 73 was used to report those procedures that were discontinued before the administration of anesthesia. The 74 is used for those procedures that are discontinued after the administration of anesthesia. So here is an example of the appropriate use of modifier 74. Patient with right ureteral calculus presents for cystourethropy, lithotripsy, and stent placement. The patient is prepped and general anesthesia is given. The provider inserts the scope and encounters a stricture. The provider makes more attempts, withdraws the scope, and cancels that procedure. So, how does use of the modifier 74 affect Medicare's payment? Surgical or certain diagnostic procedures that are discontinued after the procedure has been initiated or after the patient has received anesthesia for which modifier 74 is reported will be paid at 100% of the full OPS payment amount. And OPS, remember, is the outpatient prospective payment system. Here is the appropriate use of modifier 74. When the well-being of the patient is threatened, the physician may terminate that surgical or diagnostic procedure after anesthesia is administered or after the procedure was actually started. And this would include after an incision is made or intubation takes place or after a scope is inserted. Only outpatient hospital facilities and ASCs should report this modifier. It is not used by the physician. Inappropriate uses are listed here on this slide. We're talking about modifier 74. It is inappropriate to report a modifier 74 when the physician electively cancels or postpones a procedure based on the physician's decision or by the patient's choice. It's also inappropriate when termination of the procedure occurs prior to the beginning of the procedure or the administration of anesthesia. And I've already mentioned this. Use of this modifier by a physician is inappropriate. It is to be reported only by the facility, the outpatient hospital, or the ambulatory surgical center. I do want to talk about anesthesia because of these modifiers being dependent on when the patient has received anesthesia. I think it's important that we talk a little bit more about anesthesia, and anesthesia can take various forms, and these are listed here on the slide. So by saying before or after anesthesia, what we're talking about here is before or after the local or regional block, moderate sedation or analgesia, and this would include conscious sedation, also deep sedation or analgesia, and finally, general anesthesia. A couple of you mentioned when you registered that you wanted some information about what needs to be included in the documentation when reporting a modifier 73 or 74. Documentation is always important when billing Medicare, no matter what is being billed. Remember that Medicare can only pay for items and services that are reasonable and necessary, and this is based on information in the Social Security Act. On this slide, I've included what should be included in the medical record for a terminated surgery. So the operative report should specify all of the following: the reason why the surgery was terminated or canceled, stopped, not electively, remember. The services that were actually performed, what was rendered that day before the surgery was canceled or terminated. What supplies were actually provided until that decision was made. Also, what services that were not performed that should have been performed or had planned to be performed if that surgery had not terminated. And also include in that operative report the supplies not provided that would have been provided if surgery had not been terminated. There's other items to consider or other information that needs to be included in your documentation for the terminated surgery. You need to indicate the actual time spent in each stage. What we're talking about here is the preoperative services, the operative services, and the postoperative services. Indicate the time that would have been spent in each of these stages if the surgery had not been terminated. And finally, include the HCPCS code for the procedure had the surgery been performed. We want to know what was planned and what should have been performed, what was terminated. Of course, this is going to be the HCPCS code or CPT code that appears on your claim along with the modifier 73 or 74. But these are all items that should be included in your documentation. During the registration process, in addition to making suggestions for future education, and I can tell you that I have placed those suggestions on a list of topics that my colleagues all look at when determining education that needs to be provided. In addition to the feedback that we get in your surveys, and remember, you'll be given an opportunity to complete a brief survey following today's event. We also look at data. We look at things like claims that have the most rejections or denials, or specialties that have most rejections and denials. Perhaps we'll find that our data at WPS pales in comparison to some of data for other providers nationally. So we'll take a look at those situations to determine the need for surgery. Likewise, of course, we want to hear from you in our survey. We want to know the kind of education that you are looking to attend, that which WPS can offer. So this is a great opportunity for you to let us know those things when you're completing that survey. During registration, in addition to those topics you suggested already, and you may think of more, of course, there were some questions, or one question in particular, that I wanted to really address, something that I didn't really address so far in this presentation, and I thought it was a really great question. Here is that question. If two procedures are planned, one is performed and the other is canceled after anesthesia due to extenuating circumstance, and in this case the learner suggested high blood pressure, can you code both procedures with a 74 on the canceled procedure? And I went looking for some documentation of this, and I actually found a change request that was issued some time ago that addresses the use of these modifiers, and in there there was some language that states when one or more of the procedures planned is completed, the completed procedures are reported as usual. When one or more is completed, and let me back up here. When one or more of the procedures planned is completed, the completed procedures are reported as usual, but the others that were planned and not started at all are not reported. When none of the procedures that were planned are completed and the patient has been prepared and taken to the procedure room, the first procedure that was planned but not completed is reported with a modifier 73. If the first procedure had been started, for example, the scope inserted or intubation happened, incision already made, and or the patient has received anesthesia, the modifier 74 is used. Other procedures then would not be reported. So if the first procedure is terminated prior to the induction of anesthesia and before the patient is wheeled into the procedure room, the procedure should not be reported. The patient has been taken to the room where the procedure is performed in order to report either of these modifiers. So if they did not go to the operating room, the procedure room, if you want to call it that, these modifiers should not be used, only when they have already been taken to the procedure room. And then, of course, it's dependent on whether or not anesthesia has started or not. All right, Aline, do we have any questions that we have received in the chat?
We do, Mary. Thank you so much. This goes along with what you just said, and I'm going to paraphrase here. In your example for modifier 74, should the facility report a CPT code for all the planned procedures with modifier 74, or only the main procedure, since that part of the procedure was completed prior to encountering the stricture?
You should report only the CPT code for the procedure that was done. If the second procedure was not done before it was canceled, based on the information in the change request, it should not be billed.
Okay, thank you. And that's the only question we received that mentioned the 73 and 74.
Okay, thank you. For those of you that may have submitted questions on other modifiers, I would like to let you know that we have been hosting a series of Modifier Monday webinars where we focus on different modifiers. It's on a monthly basis. So if you have suggestions or questions about other modifiers, make certain you provide that information in your survey feedback. Not questions, that is, but suggestions for education on other modifiers. Include that in your webinar, and in just a couple of minutes, if you have questions on other modifiers, I'll tell you how you can submit those, or have those answered rather. I do want to mention though some of the resources that I used for today's webinar. They are the Internet Only Manual, which is the Medicare Claims Processing Manual in Chapter 14, where CMS discusses rather use of these modifiers. For those of you, and because we have a couple extra minutes of time here, for those of you that have never looked at the CMS Internet Only manuals, I'll show you where you can find them. People on my team, like Aline and me, we are using these internet-only manuals very often. A lot of times we have learners ask us, well, where does it say XYZ? Well, it's in the internet-only manual. When we give a citation, such as publication 100-04, the Medicare Claims Processing Manual, Chapter 14, I'm going to show you how you can find that information. Go out to the CMS website and scroll down. You will find CMS's top resources for their website. On the far right, you'll find a drop-down for manuals, forms, and transmittals. Here is the items in that list. We have internet-only manuals, the second item listed, and that's what I'm going to select. I'm going to scroll down and find publication 100-04. That's the one cited here. And it says Chapter 14. So here is Chapter 14. I'm going to do a Control F, or you can do Find, and look for 73, because we're talking about modifier 73. So here then, you will see that up here, when the results come back, there's 7 results, and I can use the arrows to move from one to the other. Okay? So that's how you can find information in those internet-only manuals. In addition to the IOM, as we like to call them, you will find I have also included links to the Modifier 73 and Modifier 74 fact sheet. And apologize, I'm trying to get my computer to respond. It just takes a little bit of time. Again, those modifier fact sheets are out on the WPS website. I told you earlier you can go to the topic center and choose claims and then modifiers to find them. Or if you're not a navigator and you're a searcher like me, you can just simply key in, if you spell it correctly, what you're looking for, the information. So modifier 73 fact sheet right here. Definition, appropriate use, inappropriate use, and additional information. What if I'm looking for modifier 74? This time I hit enter and it came back all the results. Here's the modifier 74 fact sheet. Some important things that you might want to take note of is this date, when we published it, and when it was last updated. Again, definition, appropriate use, inappropriate use, and some additional information. This is where I got, some of the information for the presentation that pertains to documentation. Okay, so this is the information you will need in order to submit modifier 74 correctly. And of course, modifier 73, the 2 modifiers we're talking about today.
No, ma'am, I do not see any other questions related to the 73 or 74.
All right. Thank you, Aline, for all of your help today. And thanks to all of you for attending. You know, our greatest compliment is when you recommend our WPS education to others. Please help us reach our goal to provide current and effective education for everyone in our Jurisdiction 5 and Jurisdiction 8. Iowa, Kansas, Missouri, Nebraska, Indiana, and Michigan. If you belong to an organization or society that meets regularly, please recommend our education to others and help us reach those that might not have had the opportunity to attend the live event. And remember, our recordings are available on our Encore Presentations webpage and on our YouTube channel. On behalf of Aline and myself and our entire provider outreach and education team, I want to thank you for your participation. I look forward to your survey comments and hope to have you join us for future events. You may now disconnect. Have a great day, everyone.